Hello, everyone. My name is Matthew Webb, and I'm a student physical therapist with a CSCS and a BS in nutrition science. Today, I'm going to be talking about ascorbic acid, or vitamin C. This is going to be the seventh in a series of educational videos intended for healthcare professionals to help us in direct access healthcare fields become more adept at identifying nutritional deficiencies so that we can get patients presenting with one of these diseases the help that they need. Without any further ado, allow me to present to you ascorbic acid or vitamin C. Firstly, we are going to go into the very basics behind deficiency of cobalamin. Then we'll break down the science behind why patients are presenting the way that they do. Then I'll give you some takeaways to help you identify this disease. When a patient has ascorbic acid deficiency, you're predominantly going to find integumentary signs. And we'll go further into the science behind these presentations and the risk factors later in this presentation. But I just wanted to provide you an idea of what we're going to be getting into in this lecture right here. For navigating this slide, note that anywhere that you see ASC, ascorbic acid, or ascorbate, it's referring to vitamin C. Ascorbic acid stimulates transcription of procollagen type 1 and type 3 genes, which increases procollagen mRNA. This increases ribosomal translation of pre-procollagen molecules. Vitamin C is also involved in the amino acid hydroxylation reactions that will ultimately be necessary to create strong bonds in collagen. And you can see that in the bottom right, where the amino acids proline and lysine are hydroxylated with the help of ascorbate. As described in previous vitamin videos, gene expression uses methyl groups to turn off a gene and demethylation to turn on a gene. Vitamin C is a cofactor for demethylation, def- demethyl, demethylation, or turning on genes. Vitamin C's gene regulating effects are considered a partial contributor to its demonstrated ability to increase T and B cell differentiation and proliferation. Vitamin C has been shown to accumulate in neutrophils where it is thought to, due to its antioxidant properties, to protect these immune cells from reactive oxidative membrane degeneration. Impaired neutrophils are highly associated with chronic inflammation and poor immune function. So the potential improvements in neutrophil function is one reason for the touted immune benefits of vitamin C. Here are some risk factors you can look out for. Alcoholism impairs ascorbic acid absorption due to intestinal damage, and alcohol acts as a diuretic, increasing urine production, thus increasing the water soluble ascorbic acid excretion. Celiac disease is another risk factor because it causes intestinal damage and decreases absorption. As far as drugs go, PPIs can decrease bioavailability of ascorbic acid. Some subjective questions to ask would be about past medical history, and you should make note of celiac disease. Ask them what medications they're taking. Make note of PPIs. Ask about any alcohol consumption, and of course, find out what that looks like. Diseases that individuals can be at greater risk for with ascorbic acid deficiency are anemia due to vitamin C assisting in iron absorption, gingivitis, and gastritis. For clinical exam in the integumentary system, findings would be excessively dry skin over large portions of the body. And of course, you should make the distinction whether they have some other integumentary disease that could explain those integumentary findings before assuming it's vitamin C deficiency. Note that some medications are associated with excessively dry skin as well. Oral findings would include bleeding or highly inflamed gums that could be visible when the patient smiles or talks. Vitals may show hypotension, tachycardia, and tachypnea in the late stages of the disease due to the anemia risk associated with late stage deficiency. The main takeaways as far as the what, why, and how behind the presentation is that excessively dry skin, bloody and red gums, and mouth sores are integumentary and oral findings that are to be expected, as well as malaise, feverishness, and swelling under the skin. The integumentary findings are from collagen being inhibited from becoming its mature form due to impaired collagen cross-linking from decreased transcription for pro-collagen mRNA, as well as decreased hydroxylation of amino acids involved in collagen cross-linking, which is important for creating a strong collagen triple helix formation. The malaise, feverishness, and swelling under the skin is associated with an impaired immune system. Note the skin is also considered an immune system organ since it's an important protective barrier that keeps pathogens from entering the body. This action is not as effective in vitamin C deficiency for reasons noted above. Vitamin C is also important to the immune system because it is involved in methylation action to turn on genes that increase T and B cell differentiation and proliferation. Vitamin C also accumulates in neutrophils, where it can protect them due to its antioxidant properties from reactive oxidative membrane degeneration. Impaired neutrophils from oxidative damage are associated with chronic inflammation and poor immune function. So, this could be another reason for impaired immune function and vitamin C deficiency. And here are my resources. Thank you for watching. Note that I am making these presentations during a pretty busy semester, so I'm liable to have made some mistakes. If so, let me know in the comments, and if your correction checks out, then I'll either add it to the video description or I'll pin your comment. If you learned something from this video and you want to learn more, continue on to the retinol or vitamin A video, because we're moving on to the fat fault